Um, well, thank you everybody for joining. My name is Stephanie Swerzik. I'm the owner of Simplified Financial Solutions. I'm an independent insurance agent that assists people with enrolling in Medicare solutions, Medicaid spend down strategies, health insurance on the marketplace. So glad that you could all join us today. We do have a full schedule. We've got 4 guest speakers that I'm excited to introduce today. We have Joni Gebhardt with DHHS, and it's going to talk a little bit about ICAP overview and the impact on day programs and residential services. Ann Reimer with the League of Human Dignity is going to, we're going to talk about the understanding the role of a service coordinator. Scott and Samantha Larrabee are from With My Life, and they're going to share about what are shared living services, who do they work best for, what are day programs, and who those day programs work best for. So it's going to be a different format today. We're going to kind of do an interview format where we'll ask questions to our guest speakers, and then we'll have time at the end for some questions and wrap up as well. I wanted to just kind of provide a little bit of a summary. This is the 5th in the series. If you've missed the first 4 sessions, they are recorded and you can access those. There's links which play through YouTube, so you could go back and watch some of the sessions. But this all started basically when a lot of us were getting questions on, do I qualify for Medicare? Do I qualify for Medicaid? Do I qualify for both? How do the services differ? What am I eligible for? What kind of benefits am I eligible for? So we've kind of expanded in some of those different areas. We've talked about what are the requirements for eligibility, the difference between supplemental security income versus Social Security disability income, home and community-based waivers. We're going to touch a little bit on that today. Medicare plans, enrollment options, enrollment periods, long-term care strategies. That's kind of an important thing that a lot of people need services long-term. We talked a little bit about Nebraska's Medicaid expansion program, the special needs programs that are available, and what it means to be dual eligible. There's waiver programs. There's a couple of different types of waiver programs. So, and then we've provided some case studies to kind of bring all those topics together. So there's a ton of information centered around all of these, both Medicare and Medicaid. And so we hope that it's bringing value. So we're going to go ahead then and move forward here and get started. And so again, thanks for joining.
Hi, everybody. I'm David Thompson. I'm an elder law attorney at Carlson Burnett. I'm not going to say anything more about myself because I've been involved with all 5 panels and we only have 10 minutes. So we are extremely lucky to have Joni Gebhardt, who is the community coordinator manager for the Developmental Disabilities Division, which is housed under the Home and Community-Based Waiver Services Program. So we've talked about that a couple times, and now we're going to sort of get down into the nuts and bolts. What we're going to talk about today is something called the ICAP. And I should say, first of all, that anybody who tried to find this on Google and came up with the Infection Control Assessment and Promotion Program, we are not talking about infectious diseases. We're talking about developmental disabilities. So, Joni, I guess why don't we start off by talking about what the ICAP is and what its function is in relation to your program.
Okay, thank you, David. I'm happy to be here today to talk about our ICAP process. Joyful Stoves is also joining me. She is a policy expert with Department of Health and Human Services, and if you guys have any policy questions, she will be able to help you with those. The ICAP stands for Inventory for Client and Agency Planning. And as David mentioned, there are several waivers. The ICAP is used primarily for those individuals who qualify for the Developmental Disabilities Waiver. And it's used to determine the level of services and supports that a person needs. And it does result in a funding amount that's called an individual budget amount. And this money is put into the individual, the participant's budget, and it is used to purchase their services through the developmental disabilities waiver. And by that, I mean it would be a day service or a vocational service, excuse me, or perhaps a residential service. Through the ICAP, we assess adaptive skills, and that includes motor skills, social and communication skills, personal living skills, and community living skills. And we also assess the person's behavioral needs.
Could you say a little bit about who the, sort of typical person and how they come into your office and needing an ICAP? Where are these individuals coming from in the state?
Okay, so we serve people with developmental disabilities. So it would be people who meet our state statute for an intellectual disability or a related developmental disability.
Mm-hmm.
We do have a waiting list for services. David, you and I talked about that. We have a couple thousand people, unfortunately, waiting for our services because we only have a certain amount of money to serve people in Nebraska. We get that from the state legislature, along with the additional funding we receive through the Medicaid waiver. Typically, people will be referred to us through the school system. We generally, when a person transitions out of school, they generally are able to transition into a day program through developmental disability services. People get on our waiting list from a young age if they are eligible, and generally wait for a day service or some sort of residential service.
So one of the things you and I talked about the other day is the specific kind of questions that the ICAP has and the fact that it's a need-based test. And I think all of us in here on this call are familiar with various kinds of assessments. So could you talk a little bit more specifically about the ICAP being a needs-based assessment?
You are correct. It is a needs-based, excuse me, my voice isn't wanting to work today for some reason. The ICAP is a needs-based assessment, which is a little different than a lot of the assessments that are completed through the school system. So what we're doing is we are assessing the person's needs for services and supports. What type of support might a staff person have to give the participant in order to live more independently or work more independently. So most of our questions are geared to how much support does this person need in terms of their daily living skills, and how much support would they need for their behavioral interventions. We talked about sometimes people overrating. And that's kind of a fear that we have. Of course, parents, teachers tend to see their kids in a positive light, and we all want to promote our kids in a positive light, of course. And I think sometimes they take for granted how many supports and how often they are helping their child. So it's kind of hard to separate that. So a lot of times people will overrate and say, yes, my child can do that independently, when in fact they are giving them many prompts and maybe some physical assistance to complete those daily living skills.
So I think that a lot of people on this call, the social workers and the therapists, probably come into contact with ICAP when they're working with one of the agencies that you contract with. So say a little bit about the relationship between your office and all those different providers out there.
Yes, we kind of oversee and contract with a lot of different providers throughout the state of Nebraska. Those providers are the people that do the residential and day supports. They may have a workshop or supported employment situations in which they support people. We also do contract with what we call independent providers, and these would not be agency providers. It might be a friend or a family member that can come in and help provide some supports for the individual.
So you and I were talking about the numbers the other day, and I know you talked about the waiting list, but why don't you say a little bit about just how many ICAP tests are administered each year?
We have approximately 5,000 people in our services across the state. We complete an ICAP for every individual who is new into our services. So right now, with school ending and people transitioning into our programs, we're completing a lot of what we call initial ICAPs to determine that person's funding level. And then after that, we complete an ICAP every 2 years. So every year we're doing about 2,500 ICAPs.
Wow. So we have 2.5 minutes left. So one of the things I was curious about is when you do the follow-up ICAP 2 years after, and then every 2 years after that, when you see changes, what are the kind of changes you're likely to see? Like, do people have improved functionality, or do they tend to deteriorate? What are the kinds of information that come out when you do the repeat ICAPs down the line?
It can be both. Of course, we want to see people improve. We want to see people gain those daily living skills and gain more independence. A lot of the change that we see, which is a good thing, is changes in behavioral needs. Sometimes people will come into our services in crisis or having a lot of issues, and then we see those behavioral problems start to improve and people gaining more socially acceptable behaviors through their services. Then, of course, as people age, we do then see a decline in those services. Of course, sometimes people will develop dementia, or they will begin to lose those skills or develop more medical issues that then requires more funding to support them adequately.
Well, I would recommend that anybody who's interested in learning more about this actually dig into the details, because the number of skills areas that you talk about, the number of what you're calling statements of task. I mean, it's a huge test that covers all sorts of different issues. And that brings us to the end of our segment. So I just want to say thank you to Joni for an interesting conversation today.
Thank you.
Thanks, David. It's my pleasure then to introduce Ann Reimer with League of Human Dignity. And Ann, I'm going to let you go ahead and share about how you serve people, and then I'll ask you a few questions.
Okay, here at the League of Human Dignity, we authorize the Aged and Disabled Waiver, or what we call the AD waiver. Our purpose is to keep people that are nursing facility level of care in their own homes. So we provide money to agencies or private providers to help individuals stay in their home.
Great, awesome. Well, can you talk a little bit about what a service coordinator is and how one might be assigned to a person that needs care?
Everybody in the AD waiver is assigned a service coordinator. They are to maintain a budget for each person in the services. They're all assigned by the supervisors when the referrals come through and their initial level of care assessment is completed, and we just work with them until they don't need us anymore.
So you mentioned referrals. Where do the majority of your referrals come from?
The majority of our referrals come from social workers in the hospital or doctor's offices. We do get quite a bit of people word of mouth of the service that we have. So it's kind of a toss up on which day and what month it is where we get our referrals from.
You bet. Yeah, that makes sense. Is a service coordinator's role different for Nebraska Medicaid aged and disabled waiver versus the developmental disability waiver?
I don't know all about the developmental disability waiver, how their service coordinators go or do, but I can tell that our AD waiver, we have more of a self-guided waiver. So the consumers that are in our service self-guide what they want for their services from the get-go. So they can tell us what provider they want, and I know they can choose that on the DD waiver too. But if they want meals to be delivered to the home, do they need extra transportation? And for our consumers, they need to find the agencies that to help serve them for their best needs.
Okay. So do you help? I mean, sometimes that can be kind of a confusing process. Do you have a list of people that you can suggest or provide if they don't even know where to start?
Yes, we do have a list of all the services and what agencies serve and do whatever they do.
Okay, yeah, good. That's good. Do you see people kind of, I don't know how to better say it, maybe sugarcoating what they actually, the services they need, or there's a discrepancy between maybe what the person that's referring them says that they need versus what they believe that they actually need personally?
Every referral that we do, even if it's a social worker that brings it or sends it to our office or calls it in, we always have to talk to the individual or their guardian to verify that the information is correct.
Okay.
And then when we do our level of cares, except for the COVID pandemic, we would always do them in person so that we could physically see the person.
Probably get a better gauge of the reaction and maybe just how they answer those questions in person versus over the telephone, I'm sure. So
absolutely. And you can see people's physical needs in front of you when you're talking to them.
Yeah, you bet. So would you advise somebody, or is it possible for a person to use Nebraska waiver services without a service coordinator?
Well, kind of not. You get the Medicaid funding that we have. That's where the AD waiver comes from, is from Medicaid under their funds. But all we do is provide personal cares. So help with bathing, help with dressing, eating, all the way down the line, help with your laundry, cleaning your house. But you could hire a private person to do those things for you without going through our waiver.
Okay, but if they want some help with the funding needs, then they're going to be assigned a service coordinator and go through an assessment of sorts.
Yes.
Okay, and then if somebody would like more information on how to get started, what's a good resource for them to start?
It would just be calling us, and we explain the waiver and what it does and how to get on it or why you wouldn't qualify. We do that all day long. If you want more tangible, I know you can just Google aged and disabled waiver in Nebraska, and there's a good website that Nebraska, the state, has put up, which helps with that information.
We've got a couple minutes yet, but what would be a good turnaround time, I guess, start to finish, if somebody's referred to you?
Try to make sure that it's done within 90 days. So, but usually it's a lot less than that. Usually from the time they put their referral in to the time it's assigned to a service coordinator is a couple weeks. Okay. But we've done it sooner if we need to.
Yeah, sometimes there's emergency situations, I'm sure.
Absolutely.
So, oh, great. Well, thank you so much for your information today. And
thank you for having me.
We might have some more calls or questions at the end. So if you can hang around, that'd be awesome.
I sure will.
Thanks.
Thanks so much for joining us. Do you want to take a second and just kind of give a quick overview of your role? We're so happy to have you representing My Life and collectively some day program services. But I'll let you tell a quick overview of your current position and company, and then we can get into those questions.
Sure. I'm with My Life LLC. It's Scott and I. We own the company. I oversee our day services, among a few other things, but day program is where my specialties lie within our company. So,
perfect. Well, why don't you give us just kind of the overview explanation of what exactly what that means to be in a day program and to be hosting that and providing that services. Providing those services.
So there's lots of different options for vocational services altogether, but I'm going to kind of focus more on like day programs specifically, which is going to be more your habilitative workshops and habilitative community inclusion. So habilitative workshops, those are agency-based. They're provided at specific agency-owned, operated, or rented locations. Workshops help teach self-help, behavioral, socialization, and adaptive skills. So they focus a lot on like fine motor skills, attention to tasks, following 1 or 2 step instructions, and just general self-help skills. Habilitative community inclusion is more where our agency puts their focus, which provides teaching, self-help, behavioral, socialization, and adaptive skills. So similar services to workshop, but the vast majority of our services is completed outside of the center and within the community. And community could be parks, stores, churches. We can help them, go to concerts and get tickets. There are other services that are provided that do like supported employment or pre-vocational, but those are all done outside of agency centers.
With the time that you have spent as the owner of My Life, what can you share of some of the greatest benefits that you see being offered to the participants when they're involved in a program like yours?
We really see them blossom. We teach a lot of coping skills. If they're having troubles with behaviors or others, or just socializing with people can be really overwhelming. We really get to see them make a lot of improvement in those areas where, maybe a big stride for someone would be, they come into services and they like to self-isolate, and maybe within 6 months or a year even, maybe they're sitting with their group. Maybe they're not necessarily participating in the activities just yet, but maybe they're out there sitting with their group, even if it's for 1 or 2 minutes or 5 or 10 minutes. We get to see them develop new interests and skills. Just socialization all around is very helpful with the community-based services. And it gives a chance for the community to see our individuals as just everyday general population, and maybe not so much of the stigma that follows behind what people typically think of with developmental or intellectual disabilities.
I think that one of the things that I've had the opportunity to observe in working with similar organizations is seeing an individual make an order themselves, provide a payment at a cash register, things that normally, in perhaps their familial unit, the adult or grown up had always taken care of for them. And it's wonderful when the staff are able to really foster some of that self-efficacy and self-determination in that protected environment that allows that individual to really function to their capacity, but having that safety net for them, I think, is exciting.
Absolutely.
So how can you explain the difference of the role of some of the vocational work or a job setting, how those two things would differ between participation in a vocational training within a day program compared to what we might think of as a traditional job placement?
Sure. So like our workshops and day programs are typically not anything where they're going to make money. We can teach those skills as far as like, learning those socialization and fine motor skills and things of that nature. We can do some volunteer work as well to try and help, with the community integration and building job skills. But it has to be true volunteer work. It can't be anything where somebody would normally be paid for those sorts of things. When you move into more like, enclave work or follow along, with supported employment, those are people who are ready to have community-based jobs, typically with support for a little while. but not for an extended period of time.
Okay. And then how about when you think about participants that have just blossomed and been so successful in similar programs, what are some of those characteristics for an individual that might do really well? And then also to be recognized, some of the limitations or characteristics for someone who perhaps a day program wouldn't be the most ideal setting?
To go into a day program like habilitative workshop or habilitative community inclusion, it's going to be most beneficial for individuals who are not yet ready for the workforce, whether that be in a sheltered setting like an enclave program where there's still like staff oversight, or whether it be out in the community. Where there's maybe not necessarily staffing oversight all of the time. These are going to be people who need more assistance with, maybe they are needing self-care assistance, whether that be hygiene needs, eating needs. These are going to be individuals that have socialization skills that need to be learned, and maybe learning that is just being around others. Some of those communication skills, we're teaching how do we communicate just our basic wants and needs. Whereas if you go into more of like competitive employment, those are going to be people who are a little bit more capable of voicing their concerns or voicing questions that they have or when they need help.
Great. As you think about enrollment or an individual that would be starting a day program, can you tell us a little bit about that self-determination or self-selection process of how they are, how do they select an individual program, or is it a qualification? Is that collaboration with the service coordinators? What's the intake process if someone's interested in having that kind of opportunity for themselves or for a loved one to help make that transition?
Sure. Yep. They're definitely going to want to work with their service coordinator, and they can kind of guide them and provide agencies. I'm sure that they have a list of agencies that are available and what sort of services that they offer. Then, it's just kind of a matter of them, either doing some research on the internet. Word of mouth does a lot, but then calling these agencies and, interviewing either supervisors, managers, or directors, whoever kind of handles that within the agency. But ask about the services that they offer and ask how many people they serve, what do group ratios look like. What sort of activities are they involved in? If they're doing, workshop, what sort of skills are they good at teaching? If you're focusing on community inclusion, what are some of the volunteer opportunities? What are typical things that they do throughout their day? Some agencies all have, different processes that they complete as far as like onboarding new service participants into their programs. We, for one, will meet with the individuals and or their guardians, typically both. We offer a trial day, so that way they can come and spend a day in our day program. That allows us to do some observations on the individuals and make sure that they're a good fit for our program and that they enjoy coming here. I mean, that's a big piece. These are still self-chosen services. These participants and guardians, they choose us as providers to help them learn new skills. So it's important that they want to come.
Great. And then is the amount of time that an individual is funded to participate or eligible to participate, how is that determined? Does that come out of the ICAP assessment that's done? Is that based on your assessment for that individual? How is that determined?
How an individual, how many hours they can come to day services in general is set by the state. They're all capped at 35 hours per week, whether it be a habilitative workshop, community inclusion, supported employment, enclave, any of that is all capped at 35 hours a week by the state. Now, how much either a daily rate or an hourly rate for a participant for the agency to be paid is determined by that ICAP outcome of the funding level.
Great. The ICAP all starts there.
Yes.
So Scott, yeah, if you want to just jump in, talk a little bit about shared services and the benefits and that kind of thing.
Sure. Shared living services, it's a residential service that takes place in a private residence. It's not in a facility. So the individual does live in a regular community setting, just a regular neighborhood. The services are provided by an independent contractor through an agency. So there's a vetting process that service provider goes through. And it gives a lot of control back to the person that's receiving the residential services. They get to tour different homes. They get to meet different providers. They work with their team, their service coordinator, and their guardian if they have one, to determine which house they would like to live in and who they want to receive their services from.
Cool. So it sounds like it's different than a group home.
Quite a bit.
How is it? Yeah.
Yeah. Well, group home, from our perspective anyway, group homes and residential services, the similarities are that they're residential services, but really it kind of stops there. In a shared living home, it is that private residence. The focus is really on the person receiving that service instead of a group management or a group support for care for the individual. They get their own private bedroom. They get a lot more control over their own daily life. They choose who they work with. So it's not just that I like this person and I like this home, so I'm going to live with you now. They also get to choose the backup support for the contractor. So that way the person receiving the services is always familiar with who they're working with. There's not this constant rotation of staff. They're in control of their own schedule and really their own environment.
So the level of care could be different for different participants. Yeah. So does how does that work as far as matching it up? So the provider and how do they get that matched up?
Well, the processes are different for the different agencies that offer shared living services, but the first step really is just making sure that you're qualified to receive shared living services. Once you've done that, you want to identify different agencies that you want to interview. We always tell people, even when they talk to us, that they want to make sure that they take their time when they go through the selection process. It's important to find an agency that shares similar values as you do, because you want to minimize the conflict and increase communication as much as possible. So.
Yeah, and I know you've been doing this for a number of years and you've seen it done not so well. And then, you've been trying to, what's that difference? What sets you apart from some of the other things that you've seen in the quality?
We really like to take our time. We are not numbers driven. We want to make sure that we have the right provider to support the needs of the right person. We always want our providers to meet with the guardians first and make sure that they share a common vision and have a common understanding of what the true needs are. We encourage our contractors to communicate with the service coordinator as well. We serve as kind of a communication bridge, and we view these services as it's really an ongoing conversation. When communication is there, then you have that common understanding and common goals. And we look at shared living, it's really more as a lifestyle. It's not a job. When you look at it as a job for a provider, you're going to introduce certain limitations that you wouldn't if you really open yourself up to providing these types of services. You're sharing your life and your life experiences with the person that you're supporting in your home. And that's the approach that we encourage our providers to take.
So as far as participants, are there some participants that do better in this setting than others? I mean, is there certain things that you're looking for how to know if somebody's going to do well?
Well, it's definitely not a one size fits all. Shared living, it's more for people who are comfortable living in a private residence. Some people, they need that rotation. They need to be exposed to different people in different experiences, whether it's in the group home or in the home itself.
So there's a couple of questions in the chat. I'm just going to jump those quickly. So is it DDD waivers, or is there some other type of waiver? How does this get paid for?
It's all through the DD waivers.
Okay, so it's just through that one program.
So Medicare, Medicaid, correct.
Okay. And then, you know, somebody said, how do you provide those services? And maybe you've answered that a little bit already, but maybe just touch on that again.
I'm sorry, as far as how the services are provided?
Right.
Okay. So once the individual actually moves into the home, there's one person that is contracted to provide the support for the individual. So it's something where you're signing up to support them directly, to be available 24/7 throughout the day. There are habilitative programs that have to be run because it is a DD service. Habilitation is still, it's kind of the guiding principle. So we need to make sure that we're still teaching the people that live in the home life skills or technical skills.
Okay, one more question, and that, how do you find out about it? If somebody has a need for that kind of service, how do they find out about it?
They can give me a call if they would like to. My contact information was provided, or they can work with their service coordinator.
Okay, all right, Vicki, I'm gonna turn it back over to you.
Wonderful. Thank you, everyone, for taking the time. And I hope you enjoyed this more of a dynamic exchange with our presenters to hopefully guide some of the questions that we had in preparation. There are a couple of questions that are posted. If you would like to add anything to the chat, we can add those in queue. But let's start first with the question for going back to Anne, if you don't mind. We heard about a little bit of a waiting list for the D&D waiver and that programming. What can you share with us? You said sometimes you can get someone assigned to a service coordinator as quickly as 2 weeks.
We have no waiting list at all.
No waiting list. How many service coordinators are they housed in different entities across the state? Are they all working out of the league? How does that get
we have
allocated?
5 offices across the state, and depending on the caseload size, it depends on the counties. So like my office just does Douglas and Sarpy County.
Okay, wonderful. Thank you. And then Samantha, there was another question about attendance when someone has had allocated hours for participation in a program. What happens if someone begins missing days as far as their funding and also their place or ability to continue to participate in a program?
So every agency can give a notice. You know, if someone is consistently not coming to day program on a consistent matter, an agency can provide a written 60-day notice. Now, if you're talking about, oh, I'm going on vacation or I've had some extensive medical needs, those sorts of things, at least we personally would never have someone, you know, give a notice for those sorts of reasons. But if you are out of your services for 90 days, 90 consecutive days, you are no longer eligible for the waiver unless there was some sort of exception made, which we won't even get into. So, but you know, if you're talking about, oh, you're sick, or like I said, vacations, things of that nature, that's fine. Those hours that are allotted in the individual's budget amount, that IDA that the ICAP determines, it just stays within their budget. You know, maybe they're living at home and then they're eligible for some respite services. Maybe some of those extra funds could go towards those sorts of things. So,
as you speak about the ICB, how does an individual go about making a redetermination or reallocation? And I don't know if this is a Samantha question or a Joni question.
Sure.
But what is the process for reallocation of those funds or hours if something like that were to happen? Is that handled through the office with you, Joni, and the service coordinators, or what's the best route if something were to come up for a participant to help direct that request?
I will let Joni speak a little bit more to that, just because my information is going to be limited on that, to my understanding and knowledge. That goes back through service coordination to help. So Joni, I will let you speak on that more specifically.
Okay, well, I will give it a shot. I think
Sure.
the best thing would be to go through the individual service coordinator. People can make changes in their budget and, reallocate their services. Like Samantha said, maybe add some respite services or transportation services. But that would all be done through the individual service coordinator. They would change those service authorizations and assist in finding other providers and setting up those services.
Great. A question that I had come to me, and maybe this is, I think, probably Scott, so I don't know, to tag team, or Samantha, if you want to help with, oh, he's right there. Hey. When you are the shared living resources, when you think about the shared living, with respect to the individual housing locations, is that, when we talk about the difference between that and a group home, is that an individual residence that has one participant and the contracted provider, or is that something that would have potentially more than one individual? And is it a family unit that, sort of integrates the participant? I think just trying to, if I'm interpreting the question correctly, I think just trying to kind of conceptualize what that looks like, still a little bit different than what we might picture at a group home with, this is a facility-owned building. We bring staff in and out on a rotating basis. The participants are always there, but there's an 8-hour shift or a 10-hour shift of a staff member that comes and goes. So,
well, on the staffing side of things, you're right. It's a rotation that comes in a group home. With shared living, you are in a private residence. The provider, it could be a family. It could be a couple, it could be a single individual. We have all different types of people apply for that type of position. So after we vetted them and we found that they're qualified to provide those services, then we look back at what best benefits the individual. So they may have their own preferences where they do want to live with a married couple, but they don't want to live in a home with small children. That gives us kind of more of a direction of like, okay, we have these different providers available. Maybe they love cats and not dogs, or they're allergic to one or the other, that type of thing. So setting specific, those are kind of the initial parameters that we look for. It's just very much more person-centered. It gives much more of a personal focus to the individual. We actually have to go out, and the service coordinators do also to qualify a residence before anyone can even move into a home, or before we can consider a provider or the location. We have to do walkthroughs. We make sure that the person has access to the greater community, and that they're not just solely reliant on that residential service provider, the person that they're living with. To be able to take them out into the community, or to make those different opportunities available. For shared living, it really is more of an immersion into the community, and you more or less, it's just a better integration that way for people to learn kind of the norms of what's going on around them.
Wonderful. Thank you. I hope that answers that. If not, please let me know. And then another question, Stephanie, thanks for sharing this. And this is probably going to come to you, Joni, I think, when we were looking at the process of qualifying someone for service coordination or the waiver, what role does the medical provider of that individual have in that process?
Are you speaking for eligibility for services?
I think so. Stephanie, do you want to clarify if you have any more clarification?
Yeah, I think, yeah, eligibility, just, determining what level of services are really important to helping that individual.
So when we are determining eligibility for our services, we would, yes, look at medical records. We look at school records. We review psychological, psychiatric records. And then when a person is approved for funding, their service coordinator meets with them. They're assigned a service coordinator who goes out and meets with them to kind of review, what are you interested in? And the service coordinator is kind of the expert on the different types of services, like the shared living services versus a group home, or a workshop versus the community inclusion. So they meet with that individual and their family to kind of review what their needs are, what they would like from services. We have a real person-based service where we interview them and try to determine what their wants and needs and preferences are, and then try to match them up with those services.
Very good. Let's see, other questions? A few minutes left. As people, if anyone wants to add anything new, I don't know if any of the other, any of the presenters had anything that one of the other presenters spoke to that fostered any additional pieces of information that you'd like to add in. Just having heard some of the other pieces, the other overviews from the presenters, but I'd welcome that if anyone has anything additional to add, or something that maybe we didn't ask that you have, the most common question you get individually, or something that would be a valuable morsel that maybe we didn't tap into.
Hey Scott. I just want to ask Scott something quick. So you had said something that you do look at, bringing on new providers. So I don't know if you want to talk about that a little bit.
Well, for my life, we work really it's really by word of mouth. We feel that we're more confident in the placements that we make if we're familiar with the people that we're working with. So we typically don't post for positions. We have people refer friends, coworkers, people that have experience maybe in foster care, that they'll get a hold of us, and we have an initial meeting with them to kind of see where their interests are and what motivates them to take on that type of a responsibility. And then if we feel that they're a good fit with our agency, then we would begin circulating their information with guardians that are also looking for a placement. And kind of, it's just the first step in what becomes hopefully a lifelong process.
And just to kind of add on to that a little bit, so every provider gets vetted, whether they are an applicant that walks in through the door as a referral process, from maybe another provider that we already work with, or they came from another agency, or maybe they work with a guardian of one of the individuals that we already serve. We will complete background checks. They go through agency training. What is habilitation? What are individuals' rights? Like, what do those sorts of things look like in a home setting? Additionally, we continue to interview with, what are the things that you like to do? What are your areas that you specialize in? Scott and I both have individuals that still live with us in our home, where we do shared living. I, for one, am not very good with highly behavioral individuals. It's just not something that I'm very good at in my home. Maybe you have an individual that has property destruction. That's not something that I would be very comfortable with. So in the process of interviewing these providers, what are your strengths? What are things that you can work with? What are things that you can't work with? What are some of your interests? Because we want to match somebody in your home that has similar interests, because that's going to make a better partnership. The things that you can go out and do in the community, your area of expertise as a provider is going to be able to thrive because you have an individual who is a good fit with you.
I might just add that of all the waivers, I think the waiting list for services is unique to developmental disabilities waiver. We have the waiting list for services. Now, we also do have service coordinators that can work with folks that are interested in perhaps just having a service coordinator help them with their transition out of school, or maybe help them locate certain services. That is always available to people.
And kind of to add to that, Joni, is there a different wait list? Like, it kind of seems that people become eligible for day services sooner than residential. Does the state break those down into two different wait lists?
Yes, we always have to make sure we have enough money from the legislature that appropriates our funding, but generally we've been able to automatically serve people who transition out of school. So yes, that always happens a little bit quicker than residential services. People do tend to stay on the waiting list a little bit longer for those residential services.
Sure.
For the residential services, are there specific ages? Is it from like 19 to whatever? Or is there any specific age limit on those?
No, residential services are under, the developmental disability waivers are eligible to all individuals who qualify. From our experience, we don't typically see a lot of children, under the age of 19. But it does happen, maybe a family can't support them in the needs that they require.
God, I don't know if
what is like the oldest person that you've been exposed to?
Probably 68 years old.
Yeah, that's about how old he was. And that was a gentleman who had lived with us that we served in what was at the time extended family home that has now been relabeled, shared living services. So a DD waiver is not something that you age out of. These are services that can continue on for the lifetime of the participant.
And I can add, as a physical therapist, I provided services in an individual's home back when it was extended family housing, and he was 82. So he was an elderly gentleman with cerebral palsy who that was his living arrangements, and we worked with him there. So it's, as you mentioned, it's a lifelong eligibility as long as the needs remain intact. So did you speak to that, Scott? The question is shared living services available under AD waiver as well as the DD waiver, or is that exclusively a DD waiver benefit?
That is a DD waiver.
For the AD waiver, we do not do any housing. They either live with their family, friends, have their own house, have their own apartment. We don't have anything to do with housing.
And correct me if I'm wrong too. I mean, some of the kind of differences in our services as well is, you had kind of spoken to needing, you assist with those personal cares. Our job under DD waiver is habilitation. All of our services have to be habilitative. We have to teach a skill, a technical ability, a behavioral skill, coping skills, anything that the individual wants to focus on or the team, thinks would be a benefit for them. And the team is the individual being served, the guardian, service coordination, and then agency representatives for whoever they're going through. But we have to teach some sort of a skill.
That's
and at the AD waiver, we don't. We don't teach any habilitation.
No, that's a really great distinction. And I think relevant to bring up that doesn't preclude one or the other, and really having the opportunity to support the individuals, whatever their needs are under the programs, is really what information we're trying to get out, and having such a wonderful representation of how those services overlap and differ is helping to clarify that for everyone, hopefully. So we are wrapping up on time. And so I will wrap up with just a couple of housekeeping matters. And I just wanted to thank everyone again for their time, and Joni and Anne and Samantha and Scott. Thanks to each of you for sharing your knowledge and being such a wonderful resource to our group. And let everyone know that we will have this recording available, and that will be sent out to your email where you registered to participate, as well as additional information to look at the previous recordings, as Stephanie mentioned at the beginning of the presentation, for our 4 previous topics. We're here to serve you guys. So if there are any additional topics, we hope that these have been meaningful. They've been organically informed by questions that we on the panel receive from our clients and our patients. So we're hoping that they continue to be meaningful, and our registration list continues to grow and is changing also. So we feel like we're meeting needs across multiple disciplines and professional areas, but please, we do welcome any suggestions or guidance on areas of topics that would be meaningful to you as individuals. And then the last thing would be to let everyone know, if you want to mark your calendar, we will be doing our next presentation on July 4th. It's over the noon hour as well. And we are going to target in a little bit more on a specific content area that we're really excited to serve. And we're going to be looking at specifically Veterans Administration services, looking at the pension and disability eligibility, as well as community services available for our military families. So hopefully that's a topic that will provide some additional information that is not always super easy to access either, if anyone's tried to navigate the VA system. But oops, did I misspeak the time? Sorry, July 14th at noon. Thank you. But we're excited to have that additional information available too. So July 14th at noon, hopefully that fits on your calendar. And again, I'm so grateful for everyone's contribution and your interest today. Have a great rest of your day.